Good evening, everyone. Thank you for joining. My name is Leslie Dock. I'm the chair of Protect Our Care, and we're joined tonight for this important call by 6 champions of healthcare, 6 Democratic leaders in the Senate, 6 senators who are fighting for America every single day. Senator Murray, Senator Whitehouse, Senator Blumenthal, Senator Casey, Senator Murphy, and Secretary Hassan. We're here to talk about, as you know, what's happening in the U.S. Senate tomorrow. But we talk tonight at a time when over 8.6 million Americans have had coronavirus, when over 225,000 Americans have died, close to 150,000 of those deaths occurring after the House passed the HEROES bill in May, when over 60 million Americans have filed for unemployment, and over 10 million Americans have lost their health insurance. This is a tragedy for all of America, both a health tragedy, a human tragedy, and a financial tragedy. And yet, despite all this, the Republicans of the U.S. Senate refuse to move forward on either economic relief or to put in place a plan and the resources to help America stop this virus. The virus is raging across America, and as of today, we've learned it's back at the highest echelons of the White House. 1 week after Election Day, the U.S. Supreme Court will hear a case brought by Donald Trump and Republican governors and attorney generals across the country and supported by the Republican Senate to completely take away the Affordable Care Act in the middle of this pandemic. And they do it at a time when 40% of those who voted in 2016 have already voted in this election. Over 50, about 50 million Americans have already voted. This is a blatant power grab to jam through a judge who will take away your health care. And many indeed see it as a power grab. I see it actually also, in a sense, as a coup on the Senate floor, where Republican senators are really trying to take away power from the American people while they vote. And with that, let me turn it over to our first speaker, Senator Murray, who also will, just to let folks know, will need to leave soon after her remarks. Senator Murray.
Leslie, thank you so much. And thank you to everyone on this call. You know, in order to make clear just what this Supreme Court fight meant for families, I've been asking people in Washington State to speak up about what is at stake for them if Republicans succeed in this push to confirm another anti-healthcare justice. And the response has been overwhelming. And the stories I'm hearing make clear that the stakes could not be higher. One woman, her name's Rhiannon, and she's from Arlington, Washington, and she wrote to me that she is concerned for her life. She has been type 1 diabetic since she was 10 years old. She's faced other health problems, including cancer, in the 12 years since she got that diagnosis. And now she faces a new threat, this Supreme Court nominee. If President Trump is able to make good on his promise to fill the court with anti-healthcare justices, if Republicans succeed in rushing Judge Barrett onto the Supreme Court in time to rule on their partisan healthcare lawsuit, Rhiannon, who is 22 years old, could be kicked off her father's health care plan. And since she has diabetes, insurance companies would be able to charge her more, exclude benefits, or even deny her coverage. And they could even charge her more just for being a woman. So without essential health benefit requirements, even if insurance companies sold her a plan, they could avoid covering prescription drugs like her insulin. What would all that mean to Rhiannon? Well, as she put it herself, and I'm going to quote her, right now, the ACA is the only hope I have of living past 26. There is no way I could afford a fraction of the health care that I require to stay alive, let alone thriving. And you know what? She's not alone in wondering whether she can live and thrive if Republicans succeed in using the Supreme Court to take away her health care. There are tens of millions of other people who could lose the health care they got through Medicaid expansion and the exchanges and their parents' plans. There are over 130 million other people with a pre-existing condition like diabetes who could be discriminated against by insurance companies. And there are countless other families who would suffer when plans are no longer required to cover the care they rely on, like prescription drugs and mental health care, or maternity care, or wheelchairs, or hearing aids, and a lot more. And let's not forget, this is all happening in the middle of a pandemic, which is costing lives and livelihoods. And as we are now seeing, leaving many of those who got sick with long-term healthcare complications that we're just starting to learn about. And those can include heart conditions, post-COVID fatigue, brain fog, and shortness of breath. Complications like those could be a pre-existing condition. And in addition to fighting to protect patients with pre-existing conditions, Democrats have put forward proposals to thoroughly study those long-term effects of COVID. But instead of investing in saving lives and rebuilding our economy, or priorities like researching the long-term consequences of this virus, Republicans are squarely and solely focused on rushing this nomination through. It's been reported that Senator McConnell has actually argued against moving another pandemic relief package before the election because it would interfere with seating Judge Barrett on the Supreme Court. That is appalling, even after years of this kind of partisanship. But let's be clear, the consequences of this vote will reverberate in people's health care and rights as soon as November 10th, when oral arguments are scheduled in the healthcare case, and for generations after. So my question to Republicans this week is, who do you want to be remembered for listening to? People like Rhiannon, who are simply asking you to protect their health care, or a president and party that can't even stop its partisanship long enough to hear people across the country who are speaking out, or to offer families and communities and small businesses real relief in the middle of an historic crisis? Democrats are very clear on who we are listening to: patients and families. And up until the very last minute, we are going to keep fighting against this nomination, delaying it as long as we can, and making it absolutely impossible for any Republican to claim ever that they didn't understand what was at stake for patients and families in this vote. So thank you again for everyone being on the call. And Leslie, I will turn it back over to you.
There I go. Thank you, Senator Murray, and thank you for all that you do. I hope our viewers know, the Senator is the ranking member of the Senate Health Committee, a tireless fighter for healthcare, and we hope a week from Tuesday will become the chair of that committee. And now our next speaker, Senator Whitehouse, state of Rhode Island, member of the Judiciary Committee, and also the lead author on a set of reports over the last few weeks that demonstrated the horrific impacts of dark money on loading our courts with enemies of the values that America holds dear. Senator Whitehouse.
Thanks very much, Leslie. And thank you, everybody, for joining us. Our Republican colleagues have loved to pretend that they are shocked that we would accuse them of using this judicial nomination to attack the Affordable Care Act and to accuse Judge Barrett of being the vehicle for that effort. But what they overlook is that their own party platform specifically says that they will appoint judges to reverse the Obamacare cases. President Trump has said the same thing himself over and over again, and he's launched his DOJ not to defend the law, but to attack it. And by the way, they are not selecting out the pre-existing conditions protection in any of this. They're going right at pre-existing condition protection, just like everything else in this bill. That is their stated position. And if that weren't enough, you have the money that is flowing into trying to get Judge Barrett into position on the Supreme Court. There's been a lot of public reporting about the amount of money that the Koch brothers organization, I guess there's only one of them left, but the organization is still very active, is plugging in. This is, the Koch brothers were opposed to Medicare, just to give you an idea of where their head's at. So Obamacare must have driven them right around the bend. And when they're putting money into this, that's a pretty strong signal that they have a goal here at stake. The last thing that's worth mentioning is that part of this dark money network that is behind the court packing scheme that the Republicans are implementing involves a person named Carrie Severino, who works at the Judicial Crisis Network, which runs the ads and raises the dark money to push these nominees through. But she's busy. She does other things as well. She was on the selection committee that picked Judge Barrett, and she runs money to the Republican attorneys general, who are the actual plaintiffs in the lawsuit that's coming up November 10th. So she's funding the plaintiffs in that lawsuit and picking the judge in that lawsuit. It seems pretty obvious that this is a very deliberate attempt to try to make sure they fire a judicial torpedo at the Affordable Care Act. And we want to make sure we make as much noise about this as possible so that Republicans are accountable for that choice when it happens. And maybe, just maybe, the Supreme Court dials back and doesn't do what the plan is because they're worried about all the noise we've made. Thanks, Leslie.
Yeah, thank you, Senator. And, we know there's a plan because Donald Trump has said from day one he would only appoint justices that would overturn the Supreme Court. He said it again, tweeted it again after he nominated Amy Coney Barrett to this position. So we know full well what the president believes she's going to do. And it's interesting you mentioned Medicare because, as you know, in her evasiveness at her hearing, she refused to even agree that Medicare was constitutional. So we may be back refighting the fight that you mentioned with her on the Supreme Court.
Their plan is the worst kept secret in Washington.
Yeah. Let me turn it now to Senator Blumenthal, also a member of the Judiciary Committee, a person who's argued cases in front of the Supreme Court, who was served as the Attorney General of the state of Connecticut 5 times, and is well versed in both the history and the practice of this court. Senator Blumenthal.
Thank you so much, Leslie, and thank you to you and my colleagues for giving us this opportunity, much as we would wish that we didn't have this opportunity. Let me just say, I was one of the members of the Judiciary Committee who questioned Amy Coney Barrett, Judge Barrett, closely and persistently about her views and her legal position, and she refused to commit on every single important issue, even whether Griswold versus Connecticut was correctly decided. But in a certain sense, we don't need to guess or even ask her because she has written about what she thinks should happen to the Affordable Care Act. She has written that Chief Justice Roberts stretched the meaning of the Affordable Care Act beyond its correct interpretation in order to uphold it. She has written that the dissent in King v. Burwell got the better of the legal argument. She has auditioned for this position, and she's been vetted and screened by the far right fringe groups that participate in this dark money scheme that Senator Whitehouse has so ably led in disclosing. And I was proud to join him, as a matter of fact, in that effort, most recently on Friday in releasing a report that showed how the NRA is at the tip of the spear of a dark money network that is seeking to put judges on every level of the courts that will strike down common sense measures against gun violence. I want to introduce you to someone who is a hero of mine and who I brought into the committee hearing last couple of weeks. Behind me is Conor Kern. He's a 10-year-old boy who lives in Ridgefield. I was with him on his 10th birthday, as a matter of fact, a few weeks ago. And he suffers from a hideously debilitating form of muscular dystrophy that it usually is fatal, but prevents him from playing with his brothers, He is alive today because of treatment that his parents couldn't have afforded without the Affordable Care Act. It's a pre-existing condition. And I brought Conor into that hearing room, his face and voice, to show the real harm to real people that will be done by striking down the protection for people with pre-existing conditions. I also brought in Tracy Barkley, who benefited from in vitro fertilization because of reproductive freedoms, which are a healthcare issue, and aid under the Affordable Care Act because infertility will be a pre-existing condition if the ACA is struck down. I brought into that room Julia Lozano, who had breast cancer treatment because of the ACA, and cancer, diabetes, asthma, and now COVID-19, all are pre-existing conditions that would deny millions of people in Connecticut and hundreds of millions around the country to access to health care. Last week, we boycotted the meeting, but Conor Kern was there. We left him and others there so they could watch my Republican colleagues in their anger and bile and vitriol denounce Democrats. They ran away from this issue because they know the American people are on our side. They may have the votes, but we have the American people and history on our side. On the floor of the United States Senate today, Mitch McConnell said our fears about Amy Coney Barrett and the Supreme Court striking down the Affordable Care Act are apocalyptic. That's the word he used, apocalyptic. These fears are real and urgent, and the harm to individual people is clear and present. And the only reason that Mitch McConnell and Republican colleagues can ignore it, run away from it, call it apocalyptic, is they don't care. They don't care. Let me just conclude by saying, today, Mark Meadows, the President's Chief of Staff, said that the administration is not going to control the pandemic. Shameful confession of abject failure and surrender. We know we can't count on this administration, and we know that Amy Coney Barrett is a clear and present danger, and she will author a humanitarian nightmare if she joins others on the Supreme Court who have already indicated they want to strike down the ACA. And that's why we need the American people to speak out and stand up, and we will need to act legislatively in the next session. Hopefully we'll have a Democratic majority in the Senate and a Democrat in the White House who will support whatever needs to be done to make sure people with pre-existing condition are protected. We will fight. We're not done. Over the next 24 hours, we still have a chance. But if they approve Amy Coney Barrett and she strikes down the ACA, we will be back to protect the American people.
Thank you so much for really those powerful words and for the stories that you and your colleagues brought into that room, because that's what this is really about. It's ironic that you talk about votes, because they may have the votes today, but if they waited to do the right thing and to see how Americans were going to vote next Tuesday, this wouldn't be the history we may all face. Thank you. Let me turn to Senator Bob Casey from Pennsylvania, ranking member of the Aging Committee, another person we hope will get a promotion next week, but also a tireless advocate of healthcare, a tireless supporter of Medicaid, and the value of Medicaid seem to be so important here during this crisis when so many Americans have lost their healthcare due to what's happened with their jobs. And let me turn it over to Senator Casey.
Well, Leslie, thanks so much for this opportunity that Protect Our Care has given us and has provided an opportunity for a number of us over many, many months now to make the case on the Affordable Care Act and to, in this context, to make it very clear to the American people what is at stake. As you heard from Senator Murray, Senator Whitehouse, and Senator Blumenthal, and I know Senator Murphy, who follows me, all of us have stories to tell from people back home. Each of us could tell not just one or two or three, but 40 or 50 or 100 stories individually. I'll just mention two families in my remarks. But really, when you think about this, it starts with the person and the party that has nominated Judge Barrett. The president who nominated her, the president who, it was made clear, as Dick Blumenthal said, will now surrender to the virus, is the same president who said back in May that he, quote, we want to, quote, terminate healthcare under Obamacare, unquote. When he says Obamacare, of course, he means the entire Affordable Care Act, both the Obamacare part, the exchanges, so to speak, but also the protections for pre-existing conditions and so many others. But it really isn't, in the end, about this one judge and what she is all about. It's really about what she will do, and what she will do in particular that will affect the lives of the people that we represent. I'm just holding here a copy of a letter sent to her, a statement made by a mother, Erin Gabriel. She's from Beaver County, Pennsylvania, way over on the Ohio border. And it's about, here's how she describes Abby's circumstances. She says that Abby just celebrated her 11th birthday last Saturday, and this is written back earlier this month, something that was never promised to us. Abby is autistic, deafblind, nonverbal, and has a rare progressive neurological syndrome affecting multiple organ systems, with a long list of life-threatening symptoms that we're still trying to learn a lot more about. She said Abby's gone through a lot medically, and then she lists all of the challenges in Abby's life. And at the end of this one paragraph, she says, without the Affordable Care Act, Abby would be uninsurable. And then another mom wrote to us, and this is Shannon Striner, and she's talking about her daughter, Sienna, who's got Down syndrome. You can see that picture of Sienna there. And Abby, Shannon had a lot of the same descriptions of what this would mean to her family, to her daughter Sienna, that Erin Gabriel had about Abby. And towards the end of her remarks, she used that same word, uninsurable, for what would happen to Sienna. She said, quote, "It gets exhausting fighting for your child, having to prove their value to the world," unquote. She said, "Once again, we are parents forced to suit up for battle and prove that our children are worthy of health care," unquote. That's what's at stake in this Supreme Court fight. I know it's about a lot of issues and a lot of cases, but it's really about those families' lives. Whether America is not just going to preserve what we have in terms of healthcare, but whether America is going to go forward and cover more people, provide more protections, or whether we're going to go backwards to the dark days when an insurance company could control the very life of a child. That's as simple as I can say it. So much is at stake. You all know the numbers. The 135 million with pre-existing conditions translates into 5.5 million in Pennsylvania. The 23 or so million who would lose coverage that gained it translates into one. We're one of the 23 million, 1 million. And when it comes to so many other issues, we're not even barely have the time to talk about. The prescription drug donut hole, the relief, the peace of mind that brought to seniors, that would be wiped out as well. Medicaid expansion, which just happened to land when the opioid crisis was raging. in so many of our states. And I know I didn't mention that Senator Hassan will follow Senator Murphy, but she and so many others who represent states that had an opioid crisis like our state did, of Medicaid expansion. So whether especially the testimony.
Senator Casey, we, I think, maybe have lost your audio for a second.
You can hear me now?
Yes.
Okay, I'm done.
I'm sorry if I interrupted you. Thank you for those remarks. I mean, in listening to those two stories, for the lives of which are really about the lives of two people, any of us who are parents, it's unimaginable to think that Republicans in the U.S. Senate would choose to impose that fate on people and do it without any reason that makes sense whatsoever. So thank you for bringing those stories and voices and people into this conversation. Let me turn it to Senator Murphy, who also really has been a tireless advocate for healthcare, who's helped to lead this fight along with others on this call every day, has been a leader along with others on this call on issues like gun safety, which are also at risk in this nomination. Senator Murphy, thanks for joining us.
Well, thanks for convening us, Leslie. I think my colleagues have covered this very well, so I'll be relatively brief. It is hysterical to watch our Republican colleagues try to pretend that the confirmation of Amy Coney Barrett is about anything other than their decade-long attempt to repeal the Affordable Care Act. It's as if they think all of us have been asleep for 10 years, that we didn't watch while they tried to repeal all or part of the Affordable Care Act 70 different times. Like we were looking the other way when they tried to repeal the entirety of the Affordable Care Act 31 different times. Like we didn't see that the moment when they had finally failed in the summer of 2017 in their legislative repeal efforts, that they snuck a provision into the 2017 tax bill that made the Affordable Care Act all of a sudden vulnerable to attack, that we didn't notice when a few months later, the Republican establishment, led by 20 Republican attorneys general, filed a lawsuit attacking the Affordable Care, surprise, based on that change made in the 2017 tax law. And that we were looking the other direction when Donald Trump broke with precedent and told his Justice Department lawyers to join that lawsuit. And let's just be clear what this lawsuit that Amy Coney Barrett is being rushed onto the court to hear asks. It doesn't ask, as Donald Trump would have you believe, for only part of the Affordable Care Act to be struck down. It doesn't leave the protections in place for people with pre-existing conditions. No, it reads, once the individual mandate and guaranteed issue and community rating provisions are invalidated, the remainder of the ACA should not be allowed to remain in effect. That is what the Trump administration, the entire Republican establishment, is asking in a court case that is pending as we speak before the Supreme Court, that Amy Coney Barrett will be able to rule on, because we are here a week before the election, getting ready for a rare Sunday night vote because of the Republicans' 10-year desire to destroy people's health care. And let's just remember what this means. This is going to happen in the middle of a pandemic. There are going to be 23 million people in this country who will likely lose their insurance in the middle of a pandemic that is on its way to killing 300,000 Americans. In Connecticut alone, we're a small state. We have about 3.5 million people. 260,000 people in our state rely on the Affordable Care Act for coverage. There's no way that the state government or hospitals or health centers could pick up health insurance for 250,000 people in our state. And on top of that, we have 70,000 people who have been diagnosed with COVID, who will all have a pre-existing condition that will allow insurers to deny them care. There are 8 million people all across the country who have a COVID diagnosis that they know about. That's 8 million people on top of the 130 million that already have pre-existing conditions that will be discriminated against because of that diagnosis. It's just really charming to listen to our Republican colleagues try to claim that Amy Coney Barrett's nomination is about something other than the repeal of the Affordable Care Act. We have been watching them chase and chase and chase and chase this bus for a decade, and they are a couple days away from catching it. The result is going to be a humanitarian disaster in this country in the middle of a pandemic. And while it may be so late in the game that our chances are slim to be able to stop it, their voters will remember in 10 days. And then we will be left in January with the task of picking up the pieces. So Leslie, thank you very much for bringing us together to talk about the just tremendously high stakes of this decision that the Senate is about to make.
Yeah, it's hard to listen to the consequences, but apparently your Republican colleagues care little about that. And just to put an even finer point on what you said, this lawsuit is coming up through the Supreme Court on November 10th, exactly 1 week after the election. So if you're trying to understand out there why the rush, why the coup, it's because they have to get that judge on the court in 7 days after the election. Let me turn it over now to Senator Hassan from the great state of New Hampshire, former governor of the great state of New Hampshire, who's also seen firsthand what it means to have this health care available to our citizens and what it will mean to have it taken away. Senator Hassan, thank you.
Well, Leslie, thank you so much to you and Protect Our Care for organizing this event, and to my colleagues, thank you for your advocacy and for being on this Zoom tonight, and for your continued work to try to stop this nomination and, as importantly, to protect people's health care and to improve access to it. Everything's been covered, but I just want to emphasize a couple of things just to echo Senator Murphy just now. Let's think about this for a minute. Senator McConnell said we were conjuring up apocalyptic images or concerns about what would happen to healthcare if Judge Coney Barrett becomes our next Supreme Court justice. Well, I remember being on the floor of the United States Senate in the summer of 2017, in those very early morning hours, when John McCain cast that thumbs down vote to protect the Affordable Care Act. We kept him from repealing it by one vote. I remember seeing how hard John McCain's Republican colleagues pushed him to vote the other way. I remember that the vice president was brought in to be a deciding vote if necessary, but also to try to pressure Senator John McCain to vote the other way. Now, why didn't he? Well, he was John McCain, and he listened to his constituents. And the other story of that summer, the story that we have seen played out over and over again, was the story of Americans coming from all over the country to tell their elected representatives how important health care, health insurance, access to the right care in the right place at the right time was to them, what a difference it made in their lives. They brought children with complex medical needs from hundreds and thousands of miles away to make the point. They shouldn't have needed to do that, but they did. And as the mother of a son with complex medical needs, I can tell you, planning that trip is like planning a military mission. But they did it. Because to the American people, this is not a legislative or political game. And to any of them who thought it might be before the pandemic, boy, do they understand the importance of healthcare now, not just to them as individuals, to their families, to their quality of life, to their dignity, to their ability to work, to the ability for a loved one who has substance use disorder to get treatment, for the person who gets COVID to be able to get into a high quality ICU and get cared for. But they know it's critical to our economy now too. They know that you can't have a healthy economy without healthy people. I too have a story from constituents that I just want to share briefly. Michelle and Joe O'Leary of Atkinson, New Hampshire, have stood up and spoken out now repeatedly about the importance of healthcare to their family. When their son Matty was 4, he was diagnosed with a very rare brain disease. And at first they were told he was unlikely to survive. There was very little known about this disease and very few treatments available. Well, the O'Leary family found out they were lucky. They live close enough to Children's Hospital in Boston that Maddie can go there every 2 weeks for a brain infusion that takes 4 to 6 hours, and that infusion has been keeping him alive and allowing him to grow and allowing their family to be a family. But they fear what will happen if the ACA is repealed, because of course, with that kind of pre-existing condition and with the expense of these infusions, they fear going back to a time when even if an insurance company would provide insurance, they wouldn't be able to afford it, and there would be a lifetime cap on the benefits. One of the other things the Affordable Care Act changed. When Michelle and Joe O'Leary have shared this story, most recently just a week or so ago, I have been so angered on their behalf that they have had to share such personal, intimate details with strangers just to try to save healthcare, something that is a human right and that the wealthiest nation on earth should so easily be able to provide. Bob Casey just did a wonderful job talking about one of the families saying, once again, they have to suit up to make this fight, and they will, because they love their family members. They'll fight for healthcare. They'll fight for their lives. But in the United States of America, they should not have to. No parent should have to go to elected representatives and plead for healthcare. They are already working so hard to care for their loved one, to get them the treatment they need, to make their family work, to hold down jobs. They'll pay their fair share for coverage. And yet my Republican colleagues want to rush this nominee through so that she can be the deciding vote to repeal, overturn the Affordable Care Act, do what they couldn't do legislatively, judicially. Their priorities are an outrage. We are doing everything we can to stop it. The American people are continuing to make their voices heard, and I know they'll continue to. And at the end of the day, we just have to keep fighting for healthcare because lives and livelihoods depend on it. Thanks, Leslie.
Yeah, just so well said, and unfortunately, you needed to say that. I mean, these are stories of hope and of resilience that are going to be turned into stories of tragedy. And I just hope Republicans in the U.S. Senate, as they rise, think about this issue, will close their eyes for a minute and think of those lives, those families at stake of 23. Imagine 23 million people waking up one morning no longer having any health insurance in the middle of this pandemic. 135 million people thrown off of healthcare by their health insurance companies. They have a pre-existing condition, and for them to just simply move on and blame others is just unconscionable. I want to thank all of our speakers. I know we've had a number of folks watching. We also have a number of folks in the media who want to ask some questions. So I'll ask my colleague, Mitch Harrell, to tee those up. Mitch?
Hey everyone, for all of our reporters on, there's a feature that says you can raise your hand. And if you have a question for any of the senators, just click that button and I will call on you. Okay, so our first question is going to be from Zach Cohen at National Journal. Zach?
Hi, Zach Cohen from National Journal. Thanks for doing this call. I appreciate it. Question for Senators Casey and Hassan. You both represent swing states in the coming election, or at least politically competitive states. Do you expect the confirmation of Judge Barrett will have any impact on how people will vote or are voting?
Well, I'll start. There's no question that healthcare itself will be will be a significant issue in the presidential campaign, as it should be, because even absent this Supreme Court nomination debate, you have a president who, as I said we want to terminate healthcare, literally his words. And so there's no question it's a major issue in the campaign. It should be, but ever more so with the nomination being rushed so that she can be there. Judge Barrett could be there as a justice for the argument. She misses the argument, she can't participate in the determination that court makes. So they want to be sure they have the votes to destroy the Affordable Care Act. Maggie?
And what I am hearing loudly and clearly from Granite Staters is that they can't believe that the Republican majority is focused on rushing Judge Barrett through when we should be coming together to do another COVID relief package. People are worried about their health with the pandemic. They are worried, if they are teachers or frontline workers, about necessary equipment, PPE, testing, a strategy that would allow us to be doing, educating our kids and reopening businesses safely. They are particularly outraged that at a time that small businesses, individuals, our state and local governments need relief, that the focus instead is on rushing a judge through. And they haven't missed the fact that the way the Republicans are doing this is in direct contravention of the rules they invented back in 2016. So they know that they've changed the rules again so that they can rush a justice through. And the focus on healthcare in my state continues. People have appreciated the Affordable Care Act for any number of reasons in our state. But in particular, I've heard again and again from people who didn't have healthcare, had a chronic condition, didn't have healthcare before the Affordable Care Act. They got laid off during the Great Recession. They couldn't go back to work because without health insurance, they couldn't get the care they needed to be healthy enough to work. We finally passed Medicaid expansion, a benefit under the Affordable Care Act, and then they could get their care. People with substance use disorder could get treatment. People with behavioral health issues could get treatment, and then they could go to work and get private insurance. So this is an actively followed issue in our state. It is a question people ask every candidate who comes through. And yes, I believe people will vote on it.
Thank you. I know I promised everyone here we'd have you off at about this time. Let me just see if there's one more question. If we have, Mitch, if there's, we could take one more. If not, we'll let everyone go back to work this evening.
Looks like that's it for questions, Leslie.
Okay. Well, I want to thank all the speakers. There's no more profound issue of importance facing the American public in the U.S. Senate than what's going to transpire over the next several days. Thank you for all that you do, the American people. Thank you for all that you do. And we'll look forward to a happier week next week than we may see this week. Thanks again.
Thank you.
Good night.
Thank you, Leslie.